Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. You know, there are some people who still have some questions about the COVID-19 vaccine, and with cases surging in many states, we've invited emergency physician and spokesperson for the American College of Emergency Physicians, Dr. Jessica Solis-McCarthy. She's joining us today to address some of these issues with the COVID-19 vaccine. Welcome to Health Professional Radio, Dr. McCarthy.
Thanks for having me here.
Well, briefly fill us in on your professional background, and then let's talk about what are some of the issues that are still facing people when it comes to the vaccine.
Well, like you said, I'm an emergency medicine doctor at UT Health San Antonio and University Health here in San Antonio, Texas. I work in the emergency department and teach medical students and residents on shift.
Is there still a lot of misinformation circulating about vaccines, about side effects and things of that nature? Is that why there is still some hesitancy?
Yeah, there's a lot of misinformation out there with regards to the COVID vaccine. Things like microchips being placed or really bad side effects that could potentially kill you are kind of one of the main misinformations that I've been hearing in the emergency department. The truth is there's actually higher risks and bad side effects from not getting the COVID vaccine than from actually obtaining the COVID vaccine itself. It's been proven and shown, especially as of the last year with thousands and thousands of people who received the vaccine, that there's not very much side effects to it aside from maybe a headache, a little bit of fever, some body aches, and maybe a sore shoulder from the vaccine side. But usually that lasts 1 to 2 days and it goes away with Tylenol or ibuprofen. But the biggest issues come from those people who are not vaccinated. In fact, the patients that are not vaccinated, they're 10 times more likely to require hospitalization and 11 times more likely to die from the COVID infection and require ICU treatment.
So if I'm understanding correctly, the vaccines or the boosters aren't necessarily designed to prevent someone from contracting COVID. It's basically to reduce the symptoms so that a person doesn't have to be hospitalized and so that a person doesn't die but recovers from the virus. Is that correct?
That is correct. The COVID vaccine is meant to blunt the effects of the infection. It's not 100% protection, but it definitely helps in preventing developing a very strong reaction to the COVID infection and helps minimize hospitalizations. Of course, this is all based on what your health baseline is. If you are someone who is of older age, who has medical issues that are not well controlled, immunocompromised, you're already kind of starting a little bit weaker than most of the population. But the COVID-19 vaccine is to help blunt the effects of the infection and hopefully help you recover a little bit easier than without it.
Speak to the notion that the development of the vaccines was rushed and therefore unsafe.
Mm-hmm. Well, the science behind the COVID-19 vaccination has been present for decades. The vaccination was not rushed. The only rushed part about it was just the logistics with the government to help get access to the vaccine in an expedited fashion. But the science behind it has been present for many, many, many years. So, a lot of the hesitancy is like, well, this was too quick. No, it's been around for a long time, and thousands and thousands of people have been vaccinated at this point, and we have not seen many cases of bad reactions.
Now, as far as a bad reaction, obviously these reactions vary from person to person, whereas one person's symptoms may be considered by another to be not bad at all, while that particular person may be saying this is excruciating.
Mm-hmm, correct. But for the most part, a lot of the side effects from the COVID vaccine are pretty light. It might be kind of very similar to when you get the flu vaccine. You might feel a little bit tired, a little bit of body aches, a little bit of fever. And that's normal. That's your body building the immunity against the COVID infection and to kind of prepare itself to fight if you are exposed to the COVID infection. But those side effects do not compare at all to actually having the COVID-19 infection that requires ICU admission and a lot of supportive care with oxygenation and potential ventilation.
There are those who say that if there are breakthrough infections in people that have been fully vaccinated, if you can still get COVID-19 after the shot, why take it at all?
Mm-hmm. Yeah. Well, again, the COVID vaccine, it's not 100% protection, but it just helps blunt the effects of the infection. So rather than you being maybe the patient that requires hospitalization with oxygen support and ICU admission, maybe you'd be someone who may be having body aches and just feeling pretty terrible with upper respiratory symptoms at home. So looking back, hindsight is always 20/20. You got the COVID vaccine and I still got sick. Well, count your blessings. I think the vaccine may have blunted the effects and didn't require you to get admitted.
As far as people who are talking about the vaccines and the breakthrough infections, are these boosters going to potentially stop these breakthroughs, or are breakthroughs still a reality even with boosters?
The sad reality is that there's still going to be breakthroughs despite the boosters. The COVID-19 virus is constantly mutating and learning and trying to get smarter and trying to get ahead of us and get us sick. And that's the whole point of the booster, that we stay on top of that and teach our body to help blunt those effects. But the sad reality is that we can still get affected by it, but the whole point of the vaccine is just to blunt the effects and decrease hospitalizations.
Immunocompromised people, older people, I can understand maybe some of the hesitancy to receive a vaccine. But when it comes to vaccines for our school-age children, didn't most or all of us have to have a vaccine against many of the diseases that we barely hear about before we could even go to school? Why do you think there's a hesitancy for this particular vaccine?
Mm-hmm. Yeah, just because this vaccine is a little different from the vaccines that we've had in the past. And again, it's science has been around for several decades, but the fact that we had to need and pull the trigger early on, earlier than most of the vaccines, kind of makes people a little bit nervous. Right now, there's current information and data with regards to getting vaccination for under the age of 12. Right now, it's okay to have children over the age of 12 to get the vaccine, but there currently is some studies to try to figure out if we could give the vaccine to younger children who, are more likely to spread the infection at school. So I understand there is a hesitancy to get this vaccine. I think it's just because of the setting in which it was established under with the pandemic, and it seemed rushed, but really it wasn't.
When the science for this vaccine, when you say it's been around for decades, and I understand that, the science was there, it was just because of the severity of the spread of the pandemic, we had to, as you say, pull the trigger now. Is this something that we should, prepare ourselves for as this virus mutates? Should we be prepared to see these vaccines come out in record time going forward?
It's very similar to like the flu vaccine, where, we have a year to collect data and learn the mutations, and then the next year we prepare for the potential mutation that could happen. So it might be very similar to the flu vaccine for its timing, but with the mutations, you just gotta have to adapt and learn, just like the virus is learning and adapting. So it's a learning curve, but I think that it's just a matter of staying on top of it and just continue to educate that this is something that should help not only yourself, but your family, as well as those that are at higher risk around you, like, your grandparents who live with you, as well as the rest of the population.
Where can our listeners go online and get some more information about the pandemic and about hesitancy for the vaccines?
You're more than welcome to go to our website at ACEP.org. That is ACEP.org, or emergencyphysicians.org.
Dr. McCarthy, thank you very much for your time.
Thank you. It was a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jessica Solis-McCarthy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.